Good day, ladies and gentlemen, and welcome to the One Action Necessary to Avoid the 4% Medicare Payment Cut webinar. All lines have been placed on a listen-only mode, and the floor will be open for your questions and comments following the presentation. If you would like to submit a question at any time during the webinar, you may use the Q&A box located on the lower left corner of your screen. Simply type your question into the box and click on the Ask button. If you should require assistance throughout the conference, please press *0 on your telephone keypad to reach a live operator. At this time, it is my pleasure to turn the floor over to your host, Patrick Bailey. Sir, the floor is yours.
Good afternoon, everyone, and thank you for joining us for this, our second webinar put on by the college in conjunction with the D.C. office as well as the SSR office in Chicago to try to bring some clarity to what you need to do to avoid the 4% payment cut under the new MIPS program for 2017, affecting your payment levels in 2019. This slide here just provides you a brief overview of the MIPS program for the first year, 2017. Again, the 2017 performance year affects your payment in 2019, 2 years hence. That's the typical way that CMS does this. So for this year, you see that there are 4 components: quality, cost, advancing care information, and improvement activities. There's no assessment for cost this year, and you see the values assigned to the other 4 components. This has caused a significant amount of consternation, confusion, what do I need to do, etc. And where we're kind of focused today is what you need to do to avoid a penalty so you don't get that cut in 2019. And to do that, we're going to be solely talking about today the component of the improvement activities, this 15% component. So reporting of their improvement activities is very simple. It's by simple attestation. You attest that you have incorporated one of these improvement activities into your practice for a 90-day period during some time of calendar year 2017. And there are 2 ways that most people have heard that they can do that. One is through a qualified clinical data registry like the surgeon-specific registry, the SSR, and then the other is the portal on the CMS website. Well, there's only one problem, and that is that the portal on the CMS website is not operative at this time. My staff here in D.C. have been told by CMS that it will not be operative until sometime after January the 2nd, perhaps as late as March the 30th. So your best option to attest that you have incorporated one of these improvement activities into your practice for a period of 90 days is to use the SSR. After I finish going over a few of the details about the improvement activities themselves, then Uli from the SSR office is going to take you through a step-by-step series of slides showing how you can accomplish this attestation literally in less than 15 minutes, and therefore you will avoid this 4% penalty on your 2017 performance. So there's over 90 improvement activities that are available, and I have provided for you here a truncated list of about 8 so that you can see that these are many times things that you are already incorporating into your practice. Uli's got a slide. We have a link on the advertisement for this webinar as well as the all-fellow email that went out that has a more complete list of these, but you just need to select one of these activities that you have incorporated into your practice for 90 days. Examples: if you've used the prescription drug monitoring program in your state, you've consulted that prior to writing a Schedule II opioid prescription, that counts. If you see and follow up new Medicaid patients in a timely manner, if you participate in a QCDR such as the SSR, if you are participating in Maintenance of Certification Part 4, all of these count as a clinical improvement activity. If you provide specialist reports back to your referring providers in a timely manner to close the referral loop, then that counts as an improvement activity. If you use a structured referral note, that counts. If you register with the prescription drug monitoring program of your state, that counts. And lastly, if you're using the surgical risk calculator, then that is a clinical practice improvement activity, and that will attestation that you have done that for 90 days during this calendar year 2017 will avoid this 4% penalty. So now I want to kind of run through for you if you're wondering, what does any of this apply to me and how do I determine that? Step one is to determine if your MIPS data is being submitted for you by either your institution, your employer, or your group. That's called the group reporting option. And if your MIPS data is being submitted for you by your institution, your employer, or your group, then you do not need to worry about this at all. Assuming that your data is not submitted for you, then you have to determine whether or not you are exempt from MIPS. There is what they call a low volume threshold that has been established. There's been a little bit of chatter on the communities about what the level is. You can't determine whether or not you have met the low volume threshold. CMS has already determined that. They began to send out letters notifying physicians whether or not they were exempt from MIPS based on the low volume threshold back in April. And you should have by this time seen one. However, with the website that you see listed there, if you plug in your NPI, it will tell you whether or not you are participating in MIPS or you are exempted. Finally, if your data is not reported for you and you have not been exempted, then your best option at this point, and here after the 1st of December, is to take the minimal action required to avoid that 4% penalty for 2017, again, affecting your Medicare reimbursement rates in 2019. And the way you do that is to attest to have incorporated one improvement activity for 90 days into your practice during calendar year 2017. You can use the SSR for this purpose. You're simply going to attest that you have done this, and again, this is your best option because the CMS interface for this purpose is not operative. So at this time, I'm going to turn the floor over to Uli in Chicago and let her take it from here and go through step by step what it is that you need to do to take this action.
Thank you very much, Dr. Daly. Okay, we're going through a step-by-step process here. As just to reiterate, there's the website there's a CMS website where you can look up if you're eligible, so that's always important. Also, I just slightly want to point out that it's a good idea to familiarize yourself with the overall MIPS program in light of 2018, where probably the option of testing it like we have for 2017 as it is a transition year will probably be not an option anymore. So it's a good idea to know what's coming your way and what do you need to report. So this is an option of showing you the different options and the level of participation. However, we're focusing only on option one, which is to test the MIPS participation. So again, you can do a very simple step-by-step process where you consent and then choose one improvement activity. I also want to highlight that it's also possible to choose one quality measure and add patient data. I'm not going through these examples again, as you already have seen some examples. We also on our website have all of the improvement activities posted. If you go to www.facs.org, quality programs, SSR, you will see MIPS, and you have all the information is really very handy. If you have any question, of course, you contact us. We'll have the contact information at the end. Now, what do you need to do in the SSR system? So the first step really is sign up and consent to the MIPS 2017 participation. The second step is you want to attest to one improvement activity if it applies to you or enter some MIPS data, review and approve your MIPS 2017 data submission. That's the third step. One thing that I want to point out, in early January, we will have the approval submission button available. It's not currently available in the system, so you want to watch out for our notification and the messages that we're sending sometime in the first half of January, so you make sure you do not miss that piece, that process step. So again, For those who have never logged in, you can register for an account, and this is what the URL for the data platform. You log in with your username and password, and this is the first main page that you see where you see cases and data that you've entered. However, going through the MIPS process only, you will go to form management in the menu right here. That's circled. Then you click on clinician form, and then you can access the MIPS consent form by clicking to add here, and if you click on it, the consent form will display. Make sure you read everything before you click the checkbox and sign off on it, but this is the first step, and after you've checked it, you scroll down a little bit. You want to make sure you add your individual national provider ID. Just on a note also, if you participate in GPRO for some reason, as was pointed out, you don't need to participate through the SSR. Also, add your TIN. Your TIN that is associated with your Medicare Part B payments. If you probably for this endeavor, if you only do minimal data, you will only enter one TIN. But if you have multiple in the future, it is possible to add multiple. Then you scroll further down, and on the same page, you will have a few questions that you can answer as you see fit, and then you go to the improvement activities. They're here called clinical practice improvement activity. That's why you see the abbreviation CPIA, but these are synonyms. And you will pick from the list of 72 improvement activities that we have available. And once you select one, then you attest for partial year in this case, for 90 days. And of course, you want to make sure that some kind of documentation in your practice will reflect that, and will be you will be able to support some documentation for the improvement activities that you're choosing. So make sure that it really reflects 90 days. So if you choose January 1st, because February is a little bit shorter, you have to account for that. So it will give you an error message otherwise. Also note that it will always give you a little message that this is approved for a partial year if a surgeon is attesting to only one improvement activity for 90 days or less. This message will appear to notify the surgeon of their selection. Now down the road, it is also possible to add multiple improvement activities. But for this year, if you only want to test MIPS participation, one improvement activity for 90 days will suffice. And one very important step at the end, you want to make sure that you save everything. So the save and exit button or save button is on the top. You want to make sure you save your entry. Now, that is what you can do right now. However, the one piece that I already alluded to a little bit is that the previous submission report is the one piece that is not in place yet, but will be in place early January, and will notify you as soon as it is going live in early January. But this is what it will look like. You will have a screen, it will showcase your name, it will show what you have selected, and then you save the submission, you approve the submission, and it will tell you then what your status is. And that means that we will then be allowed to take your data and then submit it on behalf of you to CMS, which the due date for that is March 31st. But just so you know, the deadline for approving the submission through the SSR is January 31st, 2018. You do not want to miss that deadline, so make sure you're not on vacation for 6 weeks between Christmas and the end of January. And last but not least is our contact information. We are here to help you. We are here to walk you through the process if necessary. We are happy to assist. Our SSR team consists of 3 members. So we may experience a little bit of higher call volume, so be patient, but we'll return your calls generally within no more than 48 hours. Generally it's within 24 hours, except for weekends. However, also advocacy is happy to help, and they have an ACS technical support team if you have any password issues or technical issues of any kind. We are here to help, and also quality payment program. If there is a need for you to contact CMS for some reason, this number and contact is also available to you. And with that, I want to thank you for taking the time to join our call today and how to avoid the 4% penalty for 2019. We want to thank you for your time, and we are opening up the call now for Q&A.
Thank you, Julie. I just want to point out to everybody that, as I said at the beginning, this is the second one of these that we've done this week. Both are being recorded. I have received today the link for the first recording, and I will be posting that on the community in the thread that dealt with this later today, so that you can at least go through the slides and hear Tuesday's version of this. To hear this version in recorded form will probably be up on Monday, perhaps late tomorrow afternoon, but most likely on Monday. And as Uli said, we are here to help you. We have staff available in the DC office from 9 to 5, and we're happy to assist you, walk you through this process. There is no reason for any surgeon to take a 4% cut. And as I've said across the country when I go to the state chapter meetings, if you take the 4% cut, all you are doing is putting your hard-earned money in somebody else's pocket, because this program is essentially a tournament model, and the winners are paid for by the losers. So do not be one of those that does not take this one simple step to attest to one improvement activity in 2017 and thereby accrue that 4% penalty in your payments in 2019.
Okay, thank you. The floor is now open for questions. If you do have a question, please press star 1 on your telephone keypad at this time. Okay, and it doesn't look like we have... Okay, one just came in. This question comes from Dr. Christine. Please state your question. Dr. Christine from Columbus, or DRA Christine?
Yes. How do you register through CMS to do the attestation?
You cannot register through CMS. You cannot attest for this through CMS because their portal is not live. It's not functional.
So it's not like MU where I had to go in and register as a physician that I was going to be participating, so I don't have to pre-register through CMS?
I'm assuming you're just trying to avoid the penalty for this year. If that's all you're trying to do, then if you register through the SSR, because the SSR is a qualified clinical data registry, and then go through the steps that Uli has outlined, they will submit your data for you on the attestation. They can also, for the improvement activity. You can also enter your quality data there. We've not covered that here today. That's a broader topic, a more involved topic. But staff here in my office, staff at Uli's office, be happy to help you with that. But if you're going to just attest to the improvement activity, your best option is to use the SSR because, again, the CMS portal for purposes of attesting to the completion of an improvement activity is not functional.
And just add on one step, if you are interested in confirming if you are eligible to participate, you use the link that we showed about the qpp.cms website, and we also, once we get the email information from you, we will send out some information to you. So we'll include that link in that message so you can look up whether you are actually eligible and are supposed to participate in MIPS or not.
Okay, thank you.
Okay, and that was the only live question, but it looks like we have a couple questions that came in on the computer.
Yes.
The first one said, oh, go ahead.
Okay, fine. So we have one question from Dr. Wilson. Are there penalties if you register and change your mind to participate? So if you have to participate through MIPS and you then decide not to participate in MIPS, CMS may give you a penalty in terms of that. But in the event you talk about penalties in terms of like that the SSR gives you any payment, or that we give you any penalties, we do not do that. So you want to make sure that you're in line with the MIPS program, though. I hope we answered your question.
If you are MIPS eligible, if you're supposed to submit MIPS data this year, if you've not been exempted and if it's not reported for you through the group reporting option, and you do not submit any data, then you will accrue a 4% penalty in 2019 based on your non-participation in 2017. But that's a CMS thing. There's no penalty for registering for an SSR account and then not utilizing it. But again, if you're simply at this point in time trying to avoid a penalty and you're going to go down this improvement activity path, the attestation path, this is your best option, is to attest via the SSR because that's the CMS portal to do it is not available.
Okay, there's one next question. What about a surgeon who started 7/15, like 15th of July in 2017? Again, check the eligibility because some surgeons, and it's actually a pretty high percentage actually also, who are exempt for various reasons. And how do we report as a group? If you need to do GPRO, you want to search out those vendors who support GPRO, as the SSR does only support individual reporting at this time.
If you are reported via GPRO, then your practice manager, your institution, your department head, you know, the people in the administration of your practice should easily be able to answer for you whether or not your MIPS data is reported for you under the group reporting option.
The next question is, Dr. Roberts, if my EHR submits one patient, I was told that it would be sufficient to avoid the penalty if that is submitted, and I attest through the SSR as well. Will that be a problem to do both? It should not be a problem to do both. While it's correct that one patient and one measure will be enough to avoid the penalty as well, there are a couple of different options. It's not a mistake if you want to submit, in addition, one improvement activity through the SSR or one quality measure. You can do so. It's completely up to you. And then we have a next question. Dr. Devender, I hope I pronounced that correctly. If you report through SSR, can you still report a test via CMS when available? So I think that goes back to the portal. I would imagine it's possible to once the portal is available for the improvement activities. However, one of the reasons why we recommend to use the SSR right now, we don't really have a clear timeline from CMS when that portal for the improvement activities is fully available. It might be January, it might be March, there might be a tight turnaround, so that's one of the reasons why we took the initiative to present this to you today, so you can be at peace. Thank you.
Yeah, my concern with waiting for the CMS portal is that there may be a rush onto that system and it may get overloaded and crash for periods of time.
Yeah.
And so you've got the perfectly good option of submitting it through the SSR right now, and as Uli said, put it to bed and don't have to worry about it again. We just cannot tell you. This information that they've given us about when their portal will be operative is current as of on Monday. And they can't give us any more specific date than sometime after January the 2nd, but before March the 30th.
There's one other question. I joined in late. Could you please explain how to submit through the SSR? There's some simple steps and to consent, then to select an improvement activities, and then eventually approve it. What I would recommend is if you can contact, and I'm going to show the contact information again. You can write down the number or the email of the SSR team, send us a quick email, and then we'll send you the information with screenshots to be most effective.
Yeah, and again, we will also, this webinar is being recorded, and we will post a link for that on the communities under the thread that we started with this last week. I'll post the thread for the Tuesday webinar later today, and the thread for this recording will be up either late tomorrow or Monday, and that's another option for you to go back through the slides live, and it really goes through it very nicely for you step by step.
There's one more. Dr. Roberts. If you select the quality improvement parameter of seeing Medicaid patients in a timely manner, how would you go about proving that for attestation? What we can do, we can look up what the suggested documentation is the requirement by CMS, and we can send that specific information to you. And if you want to reach out to the SSR team, just so we have your contact information faster, we will get it definitely from the webinar today as well. But if you want to reach out to us, then we can send that information to you post-call. Thank you very much. If you have any other questions, please write them in now.
Okay, we actually had a live question come in. This question is from Ellen Curley. Please state your question.
Yeah, sorry, I was trying to type it in as well. I was under the impression, the information I gathered from other sources, that in order to avoid the penalty that you also had to report for the ACI and the quality measures as well. And I guess what I'm understanding here is that you're saying in order to avoid the penalty, all you have to do is report on one measure for the improvement activities only?
There were several options available to avoid the penalty, and there was an option available for each of the three components that are being assessed this year in MIPS. One option under quality was to submit one quality measure on one patient. The option for the ACI, for the electronic health record, was to submit the base score measures for your year or your edition of the electronic health record, the certified electronic health record technology that you have, or to do to attest to having completed one improvement activity for 90 days during the year. Any one of those three options in the quality realm, in the EHR realm, or in the improvement activities realm, any one of those will get you beyond where you're going to accrue a penalty for your 2017 performance that you would see in your 2019 payments. So you don't have to do each one of the topic. It's not an and, it's an or. Okay. So that's the reason we have selected this as the simplest way to avoid it. Certainly if you are more familiar with one of the other components and can more easily do that.
So I laugh because prior to this year, we have been trying to, our practice itself, we're an ENT practice, has been keeping up with the requirements and doing our best. I'm part of a solo practitioner, and so we really can't afford to incur these penalties. And so for the past, I don't know, since this started, when it was just meaningful use and PQRS and such, those things, we've been kind of keeping up with this progress until they changed it this year. And so ourselves, I can say that through our certified EHR, we've been tracking our progress and tracking our numbers, so to speak, and so we meet lots of the criteria, so to say. We meet lots of the measures in quality and ACI, and so in my mind, I'm just thinking, is this going to be beneficial to us to go ahead and report on all of these things since we've already been doing it?
If you've already been doing it and you're routinely submitting these data, you're going to be more than over the hump past the penalty stage, and you, depending on how much data you submit and depending on how well you did on your EHR measures, if you then went in and completed the improvement activities, and if you're, and we're getting a little bit down in the weeds, but if you're for your practice, I'm assuming it's not a rural practice or otherwise a small practice, you have to attest to between 2 and 4 improvement activities. But again, it's simple attestation. If you're in a rural or small practice, it's 1 or 2 activities, and you get the full credit for the improvement activities section as well. And if you got full credit for the improvement activities and you're already submitting quality and EHR measures, then your practice could actually be one of those that competes for a positive update in 2019 based on your 2017 performance.
Who determines whether we're rural, small practice? How is that determined? Do you know?
It's determined by the number of practitioners that you have and your zip code. And if you call my office that's listed there, and I can give you the phone number, it's 202-337-2701, and ask to speak to Sadhna. She can drill down on that for you and tell you, whether or not you qualify for the small rural practice or not.
Or we're in outerlying county to a large metroplex in Texas. Like I said, it's a solo practitioner. We just have 1 ENT, so I would assume that would qualify us to be small. But it's the rural that I'm unsure of. But I appreciate that. I'll do that.
And just so you know, in addition, we also on our SSR website, and I'm happy to send you that link as well. We have a detailed webinar that probably is altogether 45 minutes, because if you're interested, if you're already in such a good place, then maybe you want to try to get a positive payment adjustment, which could be up to 4%, and that, because it might make sense to you. So you may be one of those people who want to look at the other options that is more closer to a full year of reporting.
Well, and again, I may misunderstand these measure or the segments themselves, but it was my understanding that quality, you can choose a year or the partial submission. I know we're just talking about improvement at this time, but quality was either 90 days or a year, but the advancing care information and improvement activities, you could do a minimum of 90 days, but do a year on the other, that you could split them up differently like that.
And so theoretically, there are 3 options: to test the system, partial, or full. And we have all those detailed information we can send to you, so you can be very clear about what you would like to do. But again, if you submit partial, or and contacting Sadhna will be good. Yeah.
Okay.
Thank you.
Yeah, I'll do that. Thank you.
Thank you. This concludes today's webinar. We thank you for your participation. You may disconnect your lines at this time, and have a great day.